Well, good morning, everyone. Welcome. This session is on Alzheimer's disease and other dementias. We're going to give you an update on sort of the stats, the trends, the projections, and then resources available out into the community. My name is Mary Ball. I have the privilege of serving as the president and CEO of the Alzheimer's Association, and I am joined by our education manager, Holly Pobst. So we are going to tag team the presentation today, and the worst slot you can get is that slot before lunch. So I just want to put your minds at ease that we will get you out on time for lunch. So just know that going into it. We've had some great speakers already this morning. When I listened to Darlene Shiley speak about how Alzheimer's disease and dementia has affected her family, it's just heartbreaking but so inspiring, all the work that she has done to work towards finding a cure, and of course supporting the Alzheimer's Association and other organizations that are supporting families. And unfortunately, given the skyrocketing numbers, we're all going to be touched by this disease at some point, whether it's a family member, a friend. We are all going to be touched by it. So it's so important that as a community that we do talk about it, and we are so grateful for the leadership from the San Diego County Board of Supervisors and Chairwoman Diane Jacobs. So we're thrilled to be here today, and so glad that all of you are here today. So what is Alzheimer's disease? Alzheimer's disease is the most common form of dementia. About 70% of people who suffer from dementia specifically have Alzheimer's disease. So it's a type of dementia. Sometimes you'll hear the terms used interchangeably because it's the most common form of dementia. It's a progressive, degenerative brain disease that is irreversible. It is a fatal disease. At this point, there is no treatment or cure. Typically, people live with Alzheimer's disease or dementia from anywhere from 2 to 10 years. The average is about 8 to 10 years. But oftentimes, people don't get a diagnosis for 3 to 4 years after they see symptoms. So you're going to hear our next speaker after lunch is Dr. Lisa Heikoff, and she's going to talk a lot about the importance of getting a diagnosis, because it is critical to have that diagnosis, because what sometimes people will say to us, well, gosh, there's no treatment or cure. Why do I really want to get a diagnosis? Something to keep in mind is that about 10% of the time, the memory loss is caused by something that's reversible. It could be a thyroid problem. It could be vitamin deficiency. So that's the importance of going to your doctor, and we hope that it's the 10% that can be reversed. But you're going to hear more from Dr. Lisa Heikoff on that. How does Alzheimer's affect the brain? As you can see from this slide, on the left side of the brain, that's a healthy brain. The right side is advanced Alzheimer's. So you can really see that this, again, it is a physical disease that impacts the brain. And when we look at the brain scans, you can see all the red coloring there on the normal brain scan. The middle scan is what we call mild cognitive impairment, or MCI. And you're starting to see the changes in less red, and then Alzheimer's disease. So again, this is something that impacts the brain. What are the risk factors? Well, as the picture says, everyone is at risk, and age is the primary risk factor. And so it's a wonderful thing that people are living longer. But as people live longer, the risk of developing Alzheimer's or another dementia increases. Family history is a risk factor. You know, there are many people out there who wrongly believe there's been no Alzheimer's in my family, so I won't get it. You know, the majority of cases of Alzheimer's are what you call sporadic, so they're not linked to any genetic specifics. So, you know, again, family history can increase risk, but because you don't have it in your family doesn't mean that it's not something you'll develop. Head trauma is certainly a risk factor, and we've all read articles about professional athletes and, you know, with concussions, that really increases the risks of Alzheimer's or another dementia. And then overall health, diabetes, obesity, you know, anyone who has heart disease, high blood pressure, those are all risk factors. So when we hear the county talk about live well, you know, the county's program about live well is about making sure we encourage people not to smoke, to exercise, to have a healthy diet. If you do all of those things, you are going to be lowering the risk for Alzheimer's. So it's something to keep in mind. Genetics are certainly a factor. And then Down syndrome. Many don't realize that someone who suffers from Down syndrome, if they live long enough, will absolutely develop Alzheimer's disease. And so there's a lot of research on that that's ongoing at UCSD and other institutes related to Down syndrome. So those are the risk factors. Some of the stats out there. There's more than 5 million Americans today that are living with Alzheimer's disease. Many of them are under the age of 65, so we do see many more people being diagnosed with what we call younger onset of Alzheimer's disease. And today in America, 1 out of 9 people who are over the age of 65 are living with Alzheimer's or another dementia. And as you heard the supervisor say in her opening comments, women in their 60s are twice as likely to develop Alzheimer's versus breast cancer. So we are unfortunately seeing the trends increase in terms of people affected by the disease. And as people are living longer and the baby boomers age, we're seeing the numbers skyrocket. So the number nationally is set to hit 16 million by 2050. When we look at San Diego County, more than 60,000 people today living with Alzheimer's disease or another dementia. You know, that's the size of a couple of the cities here in San Diego County. And those numbers are set to double in the next 15 years. You know, San Diego is a great place to live. It's even a better place to retire. So our population here skews just a little older than the national averages. And so we have a very large percentage of folks impacted. 80% of people are cared for by a family member at home. And the Alzheimer's Association's mission is to support those families through that 8 to 10 year journey with the disease. It's the 3rd leading cause of death here in San Diego County. 1 in 3 seniors die with some form of Alzheimer's disease or dementia. And as I mentioned, 1 in 9 over the age of 65 are currently living with Alzheimer's or another dementia. So they're pretty sobering statistics. When we look at the cost of care for the disease, Alzheimer's has been called the most expensive disease in America today. And the total cost of caring for people with Alzheimer's and other dementias is over $200 billion a year. And, you know, as the numbers are set to grow, the costs to our country and to the world are set to skyrocket. That's why it's so important that we really are investing in research dollars. And I will tell you today, 1 out of every $5 spent by Medicare is spent on someone who's suffering from Alzheimer's disease or another dementia. So you can, from the economics of the disease are set to be devastating. And when we look at this chart and we look at death rates for Alzheimer's disease over the last 8 to 10 years have grown 68%. And thankfully, you can see that death rates for breast cancer, heart disease, stroke, HIV are declining. And that's a result of tremendous investments in research that are paying off. You know, as I mentioned, Alzheimer's is a very, very expensive disease to our country. But then when we look at what we're investing in research dollars, you know, cancer is getting close to $6 billion in federal funding a year. And thankfully, that investment is paying off. We're seeing death rates from cancer decline, as I showed you on the last slide. HIV/AIDS, $3 billion. Alzheimer's is just under 600 million. There's not a billion in Alzheimer's research funding. It's a million. And that's why it's so important that all of us use every opportunity to raise our voices and push for more funding into research, because the economics of the disease are crippling. If we look at that cost of care, just as a nation, we spend over $26,000 on care for every $100 that we invest in research, which makes no sense. So we have got to push for more research dollars so we can identify a treatment or a cure for this disease. Okay, I am moving along here. And what we want to talk about now are, what are the signs of Alzheimer's disease? Because we'll have a lot of people. We get hundreds of calls a month. And there's just a few of those calls where the person will say, I'm really worried that something might be wrong with me. I misplaced my keys. You know, and we tell them, but you remembered that you misplaced your keys. You know, and we call those folks our worried well. But we want to make sure that people understand what are the signs of this disease. So when we see friends, families, neighbors, that we can help them, support them, and encourage them to go to the doctor and get some kind of a diagnosis. So I'm going to hand it off to Holly Pobst, who is the education manager for the Alzheimer's Association, and she's going to quickly walk you through the signs of Alzheimer's and dementia, and then what the Alzheimer's Association does to support families. So thank you very much.
Thank you, Mary. What a great event. Thank you all for choosing to be at this particular seminar this morning. I'm glad you're here. So as Mary mentioned, my name is Holly Pobst, and you are? Oh, fabulous. Nice to make your acquaintance. What we're going to talk about this morning a little bit is really understanding, what does that memory loss look like when it's really problematic? Like we talked about, what's normal aging? You know, all of us have lost our keys or misplaced our eyeglasses, I think. But how is that different than a warning sign that it might be something more serious? So with the time I have remaining, I'd like to delve into that. And honestly, this brings up more questions sometimes than answers, so please be aware. We've got a very full room. What we're going to do when I'm done talking here is have some of our persons from the Alzheimer's Association spread throughout the room. So if you want to have the opportunity to ask a personal question, you can do so. Does that sound good? Awesome. So please keep in mind that we have the 10 signs specific to Alzheimer's dementia, and somebody that we're concerned about, whether that's ourselves or a loved one or a neighbor or a friend, they're not going to exhibit all 10 warning signs all at once, right? They're going to have maybe one or two, And it's going to kind of come up a little sneaky, isn't it? So what I'd like to do is kind of give you some examples of what this might look like in someone we're concerned about. So number one is memory changes that disrupt daily life. Okay, so the big thing there is it's disruptive to daily life. Okay, that's not normal forgetfulness. We're talking about what you might see with someone is that they rely on their spouse to remember certain information. I might ask my mother something like, well, what did you have for brunch on Sunday when you went out with a family? And you can tell she doesn't know. And then when she turns to Dad and, to have the response, we realize, she doesn't maybe quite remember. You might have someone that is really reliant on some sort of memory aids, keeping lists, keeping instructions, even simple things like how to program the coffee pot or how to program the VCR. And without those instructions, it would be disruptive to daily life. Does that make sense, how that's a little different than just memory loss? Awesome. Number two is challenges in planning or solving problems. Well, a normal thing would be we're challenged oftentimes, aren't we? There's a traffic jam on the 5. How do we get where we need to go? Or at work, you're given a project that you find challenging. Well, that's good. That's how we grow, right? That's normal. What we're talking about here when it's a warning sign is somebody that maybe can no longer keep track of their checkbook. They're making gross errors, and it's just a little overwhelming for them. Something like as simple as following a recipe or something that was familiar in that way. Really, maybe even somebody that is still very independent and still working or volunteering, and they get to work and they're really not sure what to do. And they're sitting there for 15 minutes, 20 minutes, half an hour. They're not really sure where to start. You guys with me on that one too? Awesome. So number 3 is difficulty completing familiar tasks. Okay, what this looks like when we're talking about a loved one that might have a warning sign is somebody that might have difficulty finding the grocery store, even though it's a block and a half away and they've lived in that same neighborhood for 10 years, but they can't seem to find it. And they may not tell you, gosh, I got lost on the way home, but we realize it took her 2.5 hours to get there and back. It might be something as simple as like my grandfather, who wore a suit and tie every day. Pretty soon he came downstairs and he wasn't wearing his tie, or it would be around his neck but not really tied. That's an example of after 30-some years of wearing a suit and tie, he forgot how to tie the tie. Does that make sense? Cool. So number 4 is confusion with time and place. And what this looks like is maybe somebody that might be asking a repeated question because they're confused about the doctor's appointment, or they're confused about when, their grandson Johnny is coming to visit. The concept of time is very difficult. Or maybe they're at the senior center with you and they ask if you're the ride home because they don't remember driving themselves there independently 4 hours prior. Or you might have someone that's wide awake at 2 a.m. and they insist that it's 8 a.m. because they just don't have that concept of time. So that's when it's really a warning sign. Number 5 is trouble understanding visual images and spatial relationships. So we know a normal thing, right, as we age, is that our eyesight becomes impaired a little bit. All of our senses actually decrease a little bit as we age. Unfortunate, but true. But that's not what we're talking about here, like cataracts or glaucoma or even our vision. What we're talking about here is really how our brain is interpreting what our eyes are seeing. And very early on, even if this is maybe the only warning sign we're seeing, somebody that's exhibiting this may have very real difficulty judging distance, judging spatial relationships, for instance, how far they are away from the car in front of them, or a car beside them, or even a stationary object. At home, you may realize the person sees the stairs, but they're not interpreting that that means that the stairs go down. So you may see trip and fall accidents. They may be tripping over, like this tape here that's black and yellow. They may step over it like it's a barrier of some sort. Again, it's how our brain is interpreting the environment. Does that make sense? Cool. You guys are quick learners. We are on to number 6. New problems with words in speaking and writing. Okay, well, a normal thing would be we forget somebody's name, right? Or we forget an actor's name, or we forget a word, but it comes back to us later. When this is a warning sign is when you have somebody that maybe makes up a word for an object. They are looking at the cup, the glass of water. They know what it does, but they can't think of the word glass. And they might make up a word like, call it, I don't know, dinglehopper or something. They might get frustrated because they can't think of the word. Or like my grandmother, she was pretty clever. She could cover this one up pretty well. She would just use sort of pronouns. I need the thing. I need to go there. And what do we do as the family? We just kind of fill it in. We're like, oh, you need to go to church? Oh, you need to go see Opal, your sister? So this one comes on kind of sneaky. So really be looking for that. You might also just see that maybe they are repeating questions, or you've asked them a question and they're having difficulty answering in a sort of a manner that makes sense. Okay, number 7 is misplacing things and losing the ability to retrace steps. So show of hands, how many of you have, lost your car keys? Right, okay, all of us. That's a normal thing. What do we do, when we walk into that room deliberately, only to stop and think, what did I come in here for? Happens all the time, right? That's okay, that is normal. But what do? We retrace our steps, right? We're thinking, where was I immediately before this? What was I doing? That's the big difference. The person where this is a warning sign doesn't have that recall. It's actually completely gone. One of the things we find with Alzheimer's is it literally starts in the part of the brain where short-term memories are housed. So that's why that's one of the first warning signs we see, is that short-term recall is gone. So what happens here, though, is we see maybe some paranoia or some different behaviors. So when grandma loses the checkbook, you stole it. Or when grandma can't find the good china because she buried it in the backyard, somebody stole it. Okay, so it may come up, again, a little sneaky. They're not aware that they, hid their dentures under the mattress. They don't have any recollection of doing that. Number 8 is decreased or poor judgment. Okay, how many of you have made a bad decision? Anybody want to share? No? Okay, that's normal. We learn from that, right? And we move on. It's kind of hard to explain what poor judgment might look like, to each his own. But when we're talking about it being a warning sign for Alzheimer's, it's somebody like my sweet grandmother, where the gentleman, the teenager, came to the door selling magazines, and she wrote a check for $15,000 because he was such a nice boy. It didn't occur to her that was more money than she should have written to this man, this nice young man. You might also see, again, my grandmother, she showed poor judgment because of the way the disease was affecting her brain. She wore the same clothing for 3 or 4 days because she just didn't realize that was something maybe we should do to be taking care of ourselves. And again, that's kind of a high function of the brain, isn't it? To show, make good decisions and show good judgment. So it might even be the person's physical environment. They may have food that has spoiled, but they don't think it's important to clear that out. They may so their physical environment may be affected as well. Number 9 is withdrawal from work or social activities. Okay, a normal thing may be we're just not in the mood to socialize, we're having a bad day, whatever, that's normal. But where it's really a warning sign is you see that dad always followed the NFL draft. He's always talking about the statistics and who got drafted and all of these things, and all of a sudden he's just not really following it so much anymore. It's always given him such pleasure, and you try to engage him and he's not interested because he kind of can't keep up with all the information. Or maybe, grandma isn't going to supper club that they used to go to every month because, well, no longer can she find the house where supper club is, and she doesn't want to be a burden and ask for a ride. But also, it's overwhelming. It's loud, even if it's 6 couples or 4 couples. I'm trying to have a conversation with you and still, determine what's going on, and so I'm going to remove myself from that situation. Or even from work where this person is overwhelmed. You guys still with me? Okay, I'm getting ready to wrap up. Number 10 is changes in mood and personality. Now, a normal thing, kind of same thing, would be we woke up on the wrong side of the bed. It happens. But what we're talking about here is over sort of the progression of the disease. What you might see is some slight changes. It shouldn't be overnight. All of a sudden, somebody's totally different. But what we're seeing is maybe, I had a gentleman that I worked with. He was a big, tall, strapping, handsome guy, and he was always the life of the party, very gregarious and outgoing, and he would tell stories and things. But as the disease started to affect him, even early on, he became very quiet, very reserved, a little more to himself, which was different for him. And I'm going to tell you about my grandmother as well. I feel like I'm picking on her, but absolutely true. My grandmother was a lovely lady, always very put together. People just really enjoyed her. But the change in her personality was she had that secret vocabulary. She knew some really colorful words that we didn't know that she knew. And when those started coming out, we realized something's going on. We just kind of file those away as being not appropriate. So really what's important about getting a diagnosis, well, as my companion Mary Ball over here said, it could be any number of things, and we really want you to have access to the best care available, especially early on. So, we don't want to, even though we know Alzheimer's is the most prevalent type of dementia, we don't just want to assume it's Alzheimer's, do we? Let's make sure that we're talking with a geriatrician, somebody that's really has some expertise in diagnosing such things. It's super important. I think some of the other things that you find with an early diagnosis is really time to plan. It can be very empowering to understand that I'm suffering from a disease of my brain that at some point will cause incapacity for me. I'm not going to be able to make good decisions on my own behalf for financial decisions, for my health care. So if I know what it is and I can still make decisions, it's time for me to sort of make some of those plans. That's hugely important. And also there's so much care and support and services that are available to you, and you want to start early on so that we can all be with you, through that progression of the disease, as you're building a care team to offer support, information, maybe it's clinical trials, to support not only the person diagnosed, but their care team, families, and everyone that's involved. Our vision is a world without Alzheimer's, and just so you know who we are and what we do, essentially, we are all about research, research for the cure, because we're not there yet, really in providing care and support to persons affected not only with Alzheimer's disease, but any kind of dementia you can think of. And even if you're not diagnosed, we're here for you. If you just have questions about memory loss, that's what we're here for. And then really trying to lessen the amount of dementia by promotion of brain health. So really your big takeaway, you guys, is that we are here for you. We're right here in San Diego in the Kearney Mesa area. But this 800 number, 800-272-3900, is really the best way to access anyone on our team with any questions, really as simple as diagnosis or medications or, making a care plan. Where do we need to start? It's 24 hours a day, 7 days a week, and it's just a wonderful, wonderful thing. We have lots of free services. So it's really, I would encourage you to call that number. I know the people on the other end of the line are highly skilled and trained social workers. They speak over 170 different languages. Just a great resource for you. So some of the other services that we provide are support groups throughout San Diego County. We have lots of education classes, much like this one, on a variety of topics that you see here, like legal and financial decisions, safety, communicating with someone with memory loss, as well as, look at all of this. We've got Reiki for caregivers. We have different programs that involve not only the caregiver, but the person with the diagnosis. We have information at the back regarding clinical trials, and it's really just one of the best ways to be able to be involved. So if you have questions about that, again, we're going to have staff, if you can raise your hand, sort of throughout the room that can answer questions. Kelly in the pretty purple sweater. We've got Shalita in the back corner who's in yellow. I have Jamie Hagan who's in the green dress. So I would encourage you, if you have any questions, to please take a moment and visit with one of us. Thank you so much for your time.